I know you guys are just on pins and needles to hear about the Affordable Health Care Act. This is so exciting. What I want to do, the way I set this up to talk to you guys, I provided you with a handout here on legal and financial issues. You could take that home with you and read it. This is kind of my go-to thing that I bring anytime I speak, because these are some of the biggest concerns clients have when they come to see me, making sure that you are prepared for whatever the future brings. So I'm going to leave that with you, and I know you've got a speaker coming later on next month and the following month that they're going to fill in the rest of the information around this. So what I've done then is I have prepared another handout, and I'm going to talk about Florida statewide managed care under Medicaid, and then just hit some of the highlights about the Affordable Care Act. So the first thing that I think is important to understand, what's happening in Florida right now with lumping all of Medicaid services under the statewide managed care, and they've got some new acronyms that they've come out with. They call it the Florida Statewide Medicaid Managed Care, SMMC, Long-Term Care Program. So that has nothing to do with the Affordable Health Care Act. They are not connected in any way. This is Florida's initiative. And the idea behind this is, of course, managing the care and saving money, but also trying to get more services to more people in a better setting. In other words, if people can be served in the home, then let's serve them in the home. That they can be served in assisted living, let's serve them in assisted living. Let's find the least restrictive environment. Nobody wants to go to a nursing home when they can stay home with services. So that's the big idea behind all of this. It's being rolled out across Florida county by county. Sarasota rolled out, began September the 1st. That doesn't mean that everybody knows what's going on, because they don't. It's a learn as we go kind of process. But it is administered by the Agency for Healthcare Administration. In no way does it affect Medicare benefits. Nothing has changed there. Again, not because of the Affordable Health Care Act. This is Florida's own initiative. So what the Agency for Healthcare Administration has done is they have contracted with managed care plans, HMOs and PSNs, point of service networks. So all of Medicaid services are going to be under this big long-term care umbrella. And depending on what county you're in, if you receive Medicaid services, you're going to have to choose a provider. Sarasota County has 3 providers. Our American Elder Care, which is a point of service network, Sunshine Health Tango, and United Healthcare, which are both HMOs. If you're already in Medicaid or receiving Medicaid services, there are some categories that have to participate in the program. You must choose a plan. You're 65 or older and you're in skilled nursing, or you meet level of care for skilled nursing. If you're 18 or older, are eligible for Medicaid because of disability, and you still meet that skilled nursing level of care. So this applies to all of those assisted living waivers, nursing home diversion, aged and adult disabled waivers. So if you're receiving Medicaid services, you fall under this umbrella and you must pick a provider to manage your care. The range of providers is huge. I printed yesterday under Sunshine Health Tango, and they're still getting their websites together. That tells you how new this is. But only one of these plans actually had a provider directory that I could print out. It was about this thick. It included home health care agencies, companion care, nursing, assisted living facilities, nursing homes, you name it, there's somebody in there that provides a service. So it looks fantastic. There's a range of services to meet everybody's need. So it sounds great. My concern is, like the way things were running a few years ago, is where's the money going to come from to provide all these services? So I have not been through that process with a client yet. Last year, if I had a client who came in and they met skilled level of care and they needed assistance in an assisted living facility, or we thought they could live comfortably in an assisted living facility, then they could get on a wait list for services. The wait list had been running about a year. to get what we call nursing home diversion, funds diverted from one budget to fund care and assisted living. You're still going to go on a wait list for services, but I have no idea how long it's going to be. My guess is they're probably going to do what they've always done and try to provide something. They're going to try to give everybody a little something until the funds get straightened out, money starts flowing, and we see how this is going to work. I do believe there's still going to be a wait list, though, at some point. And when I went into the American Elder Care website and United Healthcare website, and I looked for the provider list, it said under construction. So there are still providers who are signing up. Every single day I get a long list of emails with training opportunities from the Agency for Healthcare Administration for providers, people that are providing the services, for facilities who are trying to figure out how this is going to work. So it's going to be a process. It always seems to be a process here in Florida. We have great ideas and we jump on them and then we think, now how are we really going to do this? But we always seem to figure it out. So it's going to be interesting to see exactly how it all works out. So that's Florida statewide managed care. If you are receiving services, you have to pick a plan. If you don't like your plan, you can switch. You've got 60 days to decide. If you don't like it, you can switch to another plan. I'm finding out right now, I've got a few clients who are on Medicaid services. They're looking to move from, I got one looking to move from a skilled nursing facility into assisted living. In the past, I knew the process to make that happen. The process now seems to be simpler, maybe. I call it the CARES, which is it's the department under the Agency for Healthcare Administration that determines if you meet level of care for services. Usually you call them and you say, I've got someone who is in a nursing home, they want to transition out and go into assisted living. If you do that, your benefits follow you. And they're like, oh, we don't do that anymore as of September 1st. You need to call the healthcare plan case manager. So it took a couple of days to get the right name. I got a hold of the case manager. She pulled the client's file up and said, oh, that's fine. Just tell her to go ahead and move. I'm thinking, okay, we're going to go ahead and move. I hope it turns out to be that simple. But you're actually going to have, if you're getting services, you're going to have a case manager who's going to decide based on your needs, based on the least restrictive environment for you and the services available, what are the best options for you. So it sounds really good in that it's going to be a case-by-case kind of determination. So as things progress, if I can come back at some point in the future and fill you in on the other things, I'll be happy to do that. So let me talk to you now about the Affordable Care Act. In looking at this, the biggest thing I guess is of importance to you is that there is really no relief specifically directed toward chronically ill and people with disabilities. It makes no changes to Medicare at all, does not affect long-term care policies or any of those things. It does do a few things though when it comes to getting health insurance. And one of the biggest benefits is going to be that it eliminates that pre-existing condition as a basis for receiving health care. For many people, they could not get health care because of a diagnosis. So that was one of the big deals. And when I went to listen to some information about this last year, one of the great benefits was that you had these pre-existing condition insurance pools where you could prove up that you had a pre-existing condition, that you had been denied insurance, and if you had not had insurance for 6 months, then you were eligible to sign up and get into one of these federally run pre-existing insurance plans. So many people signed up that as of February this year, they have suspended accepting any new people into the pool. They're not taking any more applications right now. I don't know what's going to happen with that, if it's going to come back. It was supposed to be in place until December of 2013. But just in case it comes back out, I wanted to give you a little bit of information about that. It covers a broad range of health benefits. It's primary doctor care, specialty care, hospital care, prescription drugs. There are some deductibles, $2,000 annual medical deductible and a $500 annual prescription deductible. And then after you meet that, you pay 30% of the medical cost. And I just printed out a little bit of the premiums just to give you an idea of if it's affordable or not. So if you're 55 plus, your premium would be about $432 a month if you are participating in Florida. So it's expensive, but it's not as expensive as some insurance plans are. But again, right now that is closed. In that program, however, the maximum you would pay out of pocket in a calendar year would be $6,250. There's no lifetime maximum or cap on the amount that the plan pays. So for some people, this would be the first time they would have had health insurance in a long, long time. So that was a big thing with the Affordable Health Care Act that we'll have to wait and see what happens with that. Another one of the benefits I thought might be important is it eliminates your annual or lifetime policy benefits. So the idea is if you're in the middle of treatment for something and halfway through the year you've hit that max that the policy pays out, that no longer will be the case. You can go ahead and get your treatment or whatever you need for the rest of the year. They extended dependent care coverage to age 26. Your kids can be covered even if they're married. They don't have to be in school. This was a big group of people out there that had no health care coverage because they got a certain age, they aged out of their parents' plan, they didn't have a job, some of them were still in school, they couldn't afford insurance, so that's been extended. I know that was, that kept one of my kids covered for a while. It did expand Medicaid to reach more, it will expand Medicaid to reach more people, those vulnerable populations. So there's a big expansion of Medicaid. All of this is rolling out over the years. And then one of the big ones is gradually eliminating the donut hole under Part D by 2020. So that seems like a long time off, but eventually they're hoping that donut hole goes away.
Now you say this is all filled up, but you can't apply for it anymore?
For the PCIPs? Yeah, I checked again yesterday actually. And it's still, there's a big red, you go to the website, there's a big red paragraph at the top that says it's right now it is suspended. Okay. Yeah. And again, they were supposed to run through December 2013. Yes?
What is the name of the website?
If you just put in pre-existing condition insurance pools, I don't have the specific website, I'm sorry I didn't write that down. I just went into Google and did it and it pulled up. The website pulled up and that was the first thing I saw was it's closed. And I heard that, but I wanted to double check.
What about the regular website for everything on the Affordable Care Act? Is it www.
You can actually go to, well, you can Google that. There's tons of stuff out there about the Affordable Health Care Act. Some of it's opinion-based. Some of it's just going to be just the facts kind of thing. If you want to know more about Florida Statewide Managed Care, there's really good stuff online at the Agency for Healthcare Administration. They actually have like a snapshot page that you can go to. So there's plenty of information out there on that.
Now we came in late, so I didn't hear your part about the managed care.
Oh, okay.
Are you saying managed care for everything? Or is it managed care is like an HMO and PPO and whatever?
Yeah, the idea is Florida has gone into what they call statewide managed care. So if you are receiving any types of Medicaid services, this does not affect Medicare.
Only Medicaid.
Any type of Medicaid services, then you have to choose a provider. And we've got 3 in Sarasota County. So they're the ones who have done a contract with the Agency for Healthcare Administration to provide services, and then they go out and they contract with the providers, the actual hands-on. So it's the idea of managing cost.
Does that mean that you have to change who you're seeing for certain doctors and things?
They can't force you to change in the beginning. They have to continue to provide services to you, but you've got 60 days No, I think it's 90 days you've got to actually find a new doctor or switch the plan. You could switch the plan to the plan where your doctor is under there. They don't want any disruption of services. Yeah. And there are choice counselors you can call, and they'll help you decide which plan is best for you. In Sarasota right now, the default, if you choose nothing, if you're on Medicaid, you choose nothing, the default is the Sunshine Health Tango.
Yeah.
They're all pretty much going to provide the same types of services. All three of these have been service providers for nursing home diversion, for assisted living help. The only difference I saw in the past was that some had a few extra perks that the others didn't have. And so you could just pick a plan that you thought suited your needs. Like one of my clients, it was a really big deal to her because she got a $25, she could spend up to $25 at the drugstore for over-the-counter things. That meant a lot to her because she only got $35 a month of her own money, and so she liked having to be able to, have that little extra money to spend on things. We also found when she moved another place that the plan she'd been on bought her Depends. The other place did not. The other plan did not, so she was not happy about that. So there's a few perks, and so you have to ask a lot of questions. But I was pleasantly surprised yesterday when I looked at the Sunshine Health Tango provider list that it was so big. My real concern at the beginning, it was going to be small. Because I said in some of the trainings, listening to the qualifications that the state had for assisted living facilities to participate in managed care. And they want a home-like environment. That was a big keyword, a home-like environment. And one of the qualifications there for that was access to food preparation. So if you're in an assisted living facility and it's a home-like environment, well, if you're at home and you get hungry, you go to the kitchen, right? Get yourself something to eat. That's kind of hard to do in an assisted living facility because you've got some people there that probably shouldn't be in the kitchen by themselves. There are safety issues. So, there were a lot of questions about that. Is a microwave enough? No, it's not. So I'm not sure how they're handling that unless they're just providing more food, access to snacks and things like that. Most of them do anyway. So there are a lot of things that they have to do to meet the criteria to even be in these plans, to participate in this. But it looks like everybody's doing their best. I mean, I've called a couple of assisted living facilities in town, and a couple of them that I've called are accepting all three of these plans. So they've done what they need to do. So that's a very, very brief general outline of what statewide managed care is and some of the things under the Affordable Health Care Act that might affect you or your family. There's a lot more in that. It's like one of my partners said, it's like trying to read War and Peace. But a lot of it affects businesses, how they have to provide insurance and things like that. So, but this is the part right here that I thought you needed to know, that it's really not going to make any difference if you're just on Medicare. The biggest difference for many would be getting that health insurance, which unfortunately right now is suspended. So, do you guys have questions about anything else for me? Yes?
If you have Medicare Part A and B, but you still want a secondary insurance,
Mm-hmm.
where is a good resource for?
Medicare.gov. You actually can go on there. It asks you, do you want to pick a plan? You put in where you live, your zip code, and it will pull up the plans in this area that you can participate in. Because the supplemental plans are also have to meet certain criteria, and so they're the ones that the state is accepting in this area. So you pick a plan, and it will walk you through the kinds of things that you're looking for, and you can pick, if you see maybe 5, you can pick that 5, and then you can do a comparison of them to see, the cost. Like Blue Cross might have 3 or 4 different plans, AARP might have 3 or 4 different plans. And so that's where I would go.
And the Affordable Care Act is affecting
No, none at all.
The same.
Thank you.
Yes, yes, ma'am.
Are there many changes for 2014 with Medicare and the HMOs, the Medicare Advantage plans?
No, I haven't heard of anything out there, really. Do you have an Advantage Part C plan now? Mhm. Are you happy with it? Yeah, good, yeah. No, no changes that I've heard of at all regarding that. I think, we're gonna be so busy trying to figure out this statewide managed Medicaid stuff that we don't have time to fill with that. Yeah, yes,
I'm
ma'am.
confused about the donut hole. Does it cover the total cost of the medication that the insurance pays plus your out-of-pocket?
Yes.
Or just your out-of-pocket expenses?
The way I think it works, and I have to tell you guys this funny story. I was at the drugstore a few years ago and I said something about the cost of my medication, and the lady next to me said, "Oh honey, are you in the donut hole?" I said, "Not yet, but one day I might be." When you hit that point, you have to pay a certain percentage out of pocket, and when you reach that max, then it'll pick back up.
My question is, what do they base the max on? The total cost of the
Total cost.
medications?
I think so.
So your insurance pays like $2,000 and you paid $500. So it's $2,500?
No, I think it's out of pocket. You're out of pocket. Your actual out of pocket medical expenses. Yeah.
It is what the insurance pays and what you pay combined.
That applies towards the donut hole?
Yes,
Applies towards getting into the donut.
yes.
Getting in there, but once you're in it, it's.
Well, then they take, then I think it's
What you pay to get out on the other side.
But so few people ever reach that point.
I know.
It is so much
I've heard that too.
that's, you know, unless you have catastrophic,
They call it
bill.
Out of pocket account, yeah. There are going to be a lot more changes under statewide managed care if you're on community Medicaid or what's called medically needy. Anybody in here heard of those programs?
Say it again?
Medically needy, community Medicaid. That's what your friend is probably on, where he's got some services at home. Medically needy was a program you can qualify for Medicaid services on a month-by-month basis. So if you reach a maximum out-of-pocket expenses, you have like a copay based on your income. Then once you've paid that out, then you're basically Medicaid eligible for the rest of the month. And it's always been a month-by-month thing. It's been a real problem for people because you've got to report. And it's very confusing about what you actually have to pay. Because they have one brochure that's about this big, okay, that explains the program. And it says you don't actually have to pay it for it to count. Well, then why would you pay it? I didn't understand this a bit. I called up to Tallahassee to talk to the person in charge of medically needy. I said, explain this to me. And she read me the brochure. I said, well, what does that mean? I don't understand. There are going to be some changes under that, though, to make it easier. Once you qualify, they're going to say you're qualified for 6 months. So you're not going to have this month-by-month reporting thing. I think that's going to be a big help to some clients who don't need to be in a nursing home, don't need to be in assisted living, but have high out-of-pocket medical expenses, drugs, procedures, things that they have to do every single month. That's going to help. Guys, anything about that you're dying to know about powers of attorney?
Yes.
What are you dying to know about powers of attorney? Any document that was executed after October 1st of 2011 has to meet certain provisions in Florida. So if you have powers in your document that allow someone to, let's say, change the ownership of an insurance policy, or make a gift of your money, or to change the pay on death, a bank designation on bank accounts. There's a long list of things that are called superpowers in Florida now. And those have to be specifically initialed next to each power. So if your document doesn't have those specific things initialed, then you might have, your agent might have a problem using it.
What's the cutoff time limit on that, you say?
If it was after October 1st of 2011, all the documents before that are still valid, they're fine. But if you did one like last week, and you didn't initial next to those specific powers, or at some point in the document say, I'm initialing for all of these above, then it's not, your agent's not gonna be able to do those things. Yes, ma'am.
We also came from New Jersey, and we're happy to be there.
Yeah.
But now ours, we haven't changed anything about it.
That's okay.
But it was several years ago, and so as long as it just is,
It's a valid New Jersey document, it's fine.
okay.
It's fine. I do tell people if you're gonna live in Florida for the rest of your life, even if you're only here 6 months out of the year, it's probably a good idea to have a Florida power of attorney. You know, like a healthcare directive. I think they told me to talk till 11, so I think I'm done.
Thanks, Teresa.
Thank you guys for listening.